premarital grooming is a separately, it's not a topic, it's a course. So it may need a lot of things, but I am not going to cover all these things because it includes, yes, premarital grooming has a lot of subjects there. Personal adjustment and understanding social expectations, look, finance, education, expectations, many more. And how here we are going, I am only going to discuss about on the medical grounds only. There are a lot of aspects are there, premarital grooming. So I am going to touch in the medical grounds. Even in that, in the medical grounds, premarital preparation is a wide subject. So this is a, yes, even the medical grounds also, there are a lot of things are there. Genetic counselling, about the consanguineous marriage, genetic disease, chromosomal aberrations, sexual orientation, transgenders. But this presentation I am going to confine only with the sexuality related issues in the grooming. So it may be for men, also for women. Marital status, sometimes for the second marriage also, sometimes they may need for the grooming. So that is for what we have to do in the first marriage, for what we have to do, how to approach for the second marriage, who is already divorced or previous sexual failures, what is that, what we have to do. So ideal medical, that is ideal marital age, biologically 15, religiously 15 to 17, socially 26, legally after 18, culturally 24 to 28, economically above 30, logically never. Maturity of body and mind, when to marry, after the maturity of the body and mind. Completion of the education, financial stability, ability to accept the responsibility of the family, selection of a suitable partner. Once again, as per law, male 21 years, female 18 years, not before 20 years, not before 35, not after 35 years, preferably. But we are coming across so many things, so many people getting married, even not married, even at the age of 40, 42, all coming. Difference in age of the two is not as important as their relationship, but preferably not more than 5 years. Premarital guidance, why? Divorce rate is increasing. Family Court of Mumbai receives nearly 5,000 applications to divorce per year. Wrong selection of the partner. In the recent years, there has been change in the gender roles and in values. A social change is desired. There is no training course for becoming husband, wife and parent. There are a lot of courses are there, but there is no training course to become a husband and wife or a parent. Need of the hour, why? Lack of sex education at both school and college levels, already we had discussed. Medical graduates, already we discussed in the panel discussion. So, parents and teachers are also hesitant to talk, so the people get false information from the illicit source, online or some other friends and peer, which reinforces the myths and misconceptions already prevailing in the society. There is no medical specialty separately, so that is also discussed. As a result of greater number of sexual dysfunction occurs because of that. Instances of unconsummated marriages are there. Dysfunctions, divorce, marital disharmony, separation are increasing day by day. So for that, premarital grooming will be a solution. The only positive aspect in this society presently, the health-seeking behavior is better than previous years. Added risk, marriage is getting late by late. It is so common to see people of getting married even after the age of 40 or more. Nowadays, both among men and women, hormonal surge and the sexual drive would not be as that of the early 20s. So at that age, they are marrying up to the 35 men, 32 after women. They will expect more frequency for more things. So that cannot be possible. At the age of 20s, early 20s, the patient will be more active. So that the expectations cannot be occurred. So lifestyle has changed a lot. World on the fingertips through online web, porn sites have been adverse effect of their psyche. After seeing porn sites, everybody has at their fingertips, and female or the expectations of female is very, very, very high after seeing that. And male have poor self-esteem because of that. I am not able to maintain like that. All these things can happen. Weekend parties, living together, co-living culture, proliferation of massage parlors, spa, drug abuse, addiction, chemsex, dating sites for each category, for men, MSM, all these categories. So all these things are available at this juncture. So the premarital grooming is very important. How to approach? Specific doubts have to be cleared in simple words in their own language with small examples from the day-to-day life. Assess the lacking knowledge with regards to sexuality and sex education. Assess his knowledge about the nuptial, reproduction, sexual urge. Sometimes the patient may come with their own doubts. If it is not so, you have to elicit whether his knowledge is towards this side, what is there, is it correct or not. So towards that, we can give impart knowledge about nuptial, reproduction, sexual urge, sexual posture, and remove the myths and misconception about the sexuality. So majority of the people comes with the, I have lost many semen, I am masturbating for a longer year, semen is precious, so I am weak. So like that, so many things. My penis is smaller. So it's usually all the other secondary sexual characters are normal. It may be genetic acquirement. So they want more. So any fear about the sex, guilty about sex, any history of sexual abuse, clear the same. So it is a tailor-made and what the people needs, expects. So on that aspect we have to impart the knowledge. Why myths already discussed. The subject is neglected in the schools. Our society considers sex as a taboo. Parents and teachers hesitate to talk. Not in a curriculum, say the school or colleges, even the medical colleges. Secrecy leads to ignorance and evokes curiosity to know more. Because of this lacunae, a lot of myths and misconceptions about sex and sexual diseases, reproductive tract infections, and diseases about contraception prevailing in the society. Situation is taken advantageous by quacks. They propagate false information in the society through media, and this add fuel to the fire that is existing misconception in the society get reinforced. Nowadays, a lot of porn sites are already available, so I told about that. Youngsters seek Google on online sites and for clarification, but got more confused. Common myths: semen is precious, my organ is small, shrinking recent days, nocturnal emission, nightfalls lead to weakness, masturbation is injurious health, sexual timings. The premarital, that is premature ejaculation also, is a subjective. The definition, we have to understand that, and accordingly we have to impart the knowledge. That is a separate topic. Pre-cum, the pre-ejaculation fluid or pro-semen. After seeing that first time, after exposure, it may be a normal thing, but after seeing that, after exposure, they think it could be a discharge, it could be a STI, like that, or loss of semen. I am losing semen even before starting my sexual act. So all these things lead to some problem. Passing semen in the urine is called as that syndrome. That syndrome, they will say, I am weak, extremely weak, I am back pain, this pain, that pain, so fever is there. All these things are subsequently some feeling will be there. It has to be cleared. It's all not a really thing. It may be due to some other else. And other misconception in female about the breast size, menstruation, coitus is impurity, hymen is a sign of virginity, fear about the size of the male organ, women are always responsibility for the infertility. So this is a common, previously it was prevailing in the society. Females are responsible for the selection of the sex. It is not so. hysterectomy and sex, vasectomy and tubal ligation, all these things prevailing in the society. So, as per the need of the individual, we have to impart the knowledge and clear their doubts. End results, fear, anxiety, guilt, depression lead to poor self-esteem and themselves, sexual dysfunction, conflicts between the couple, marital disharmony, divorce, suicidal tendencies and suicides. So now men, individual seeks help having some doubts to be cleared with a poor esteem. Individual brought by relatives and guardians, behavior abnormality, altered orientation, appearance and attitude of the normal, not that of normal, lack of secondary sexual characters, lack of manliness. So in that case, we have to need investigations, hormonal investigations and other things, karyotyping, and pressure of performance, blamed by wife and in-laws in the event of first marriage, broken marriage. So in that case, wife who has been insulted, would have insulted him, and in-laws and a lawyer makes it worse. So in that situation, sometimes patient may come for help. Really, he may not be having really any problem. So in future, everyone may seek help. Women, fear for marriage, childbirth, child sex abuse, altered orientation, fear for sexual acts, vaginismus, lead to vaginismus, fertility period, menstruation and sex. Premarital preparation with regards to STI. So this is another part, important part apart from the sexuality. With lots of doubts about the sexuality and poor self-esteem with regards to sexuality, poor with regards to happy sexual life. All these points, people may seek help. With regards to STI, lifestyle and culture are changing day by day. Permissiveness of the society is increased. Marriage age is getting delayed nowadays. Education and job opportunities are enormously improving. Migration is inevitable. Lot of money in the hands of youngsters, IT field, like example. Weekend parties, night duties, increase in call center, drug availabilities, party culture, living together culture. I am seeing in the Bangalore, there is we will give priorities, apartments are giving priorities, apartment exclusively for living together, apartment living exclusive for co-living. So there are labeling and it's seen, I have seen. So because they prefer, even the bachelor, instead of bachelor, they prefer these people. And massage parlors, spa, and the other catering sites of proliferation. Cater the needs of the individual. So one who have any history of any type of sexual activities, the promiscuous individual can be considered differently, and all must be screened thoroughly for STI and HIV. We can't rely the history and symptoms. So if anybody have some sort of sexual contact, even though they are not having symptom, we have to screen for all these things. And one STI means we have to screen for all the other STI, including HIV. So these are the important things we have to keep in mind. Premarital screening in the wake of risk of factors, HIV screening test to rule out hepatitis and B and C, serological test for syphilis, screening for gonococci, chlamydia and mycoplasma over genitals and extragenital sites also. Extragenital sites, especially MSM, the male sex with the men. For anus and pharynx, we have to see and clarify. So examination for the presence of genital warts, molluscum contagiosum, previous scars, sores, pubic and body louse infection, scabies, finding one STI, rule out other STIs. Age, previous marriage, premarital sexual activities, premarital sexual failures, previous history of STI and HIV, occupation and duty patterns, radiations, vibratory instrumental operator. So that will affect the infertility, these radiation, vibratory instrument operators. Sexual orientation, early morning erections, nocturnal emissions. We have to ask all these things. Masturbation, any ill feelings. Physical examination, appearance, chromosomal abnormality, secondary sexual characters, hormonal deficiency, activity towards sexual orientation, mental condition, education, IQ, retardation, and any comorbidity, that is treatment for epilepsy, psychiatric condition, injury to central nervous system, spinal cord, previous history of any surgery, all these things has to be elicited, and we have to give guidelines accordingly. Male examination, pubic hair distribution, size of the penis, testes, consistency, cryptorchism, hydrocele, varicocele, hypospadias, epispadias. Extreme degree of hypospadias may lead to infertility, paraurethral duct openings, phimosis, circumcision, not circumcised or not, genital scars, female pubic hair distribution, labia majora, minora, any swelling, hypertrophy, hymen, introitus, genital scars, hirsutism, breast developments, all these things we have to examine. Both genders, in girls also, genital has to be examined, extragenital sites also to be examined. Anal sex is not uncommon in the heterosexual couple also. When there is history of exposure, speculum examination is necessary. STI in women may remain asymptomatic. Most often in women, because of the genitals are not visible, sometimes it may not be having any external symptoms. So it is occult. So we have to examine and by investigation we have to rule out. External genital has to be assessed for any abnormalities. Sexuality education, assess their sexual knowledge and knowledge about the fertilization. A brief sexual education about the genitals and the normal sexual response cycle, we have to impart the knowledge. Physiology of erection, coitus, importance of the foreplay, afterplay, fertilization to an extent. Ask for the personal doubts and over the things explained. And clear the simple words and simple examples. Posture, missionary posture and other postures has to be trained. Many times the unconsummated marriages are due to posture also. The women are not knowing how to keep their legs. They keep the legs stretched. So it is very difficult the male partner to enter. So unconsummated, and the male partner will be blamed often. So all these things we have to keep it in mind. Investigation, hormonal examination, karyotyping if necessary, and seminal analysis. Seminal analysis is a test for infertility, not for the sexual dysfunction. As far as possible, I never encourage seminal examination before marriage, unless there is a obvious testicular atrophy, he is not fit for marriage, that is different. Otherwise, when his secondary sexual characters are normal, I will not advise seminal examination. Most of them, they will come with seminal examination. If you tell something about seminal examination, your count is little less, your motility is little less. That will itself make the patient will be depressed and he will be having poor self-esteem. And examination finding of the varicocele, hypospadias, epispadias, paraurethral ducts not to be disclosed, because so many people with varicocele having children. So we have seen. So if there is really after marriage, if it is problem, only they have to reveal. Otherwise, it may itself induce some sexual problem. People with varicocele having children, bilateral cryptorchism has to be revealed. Lack of secondary sexual characters have to be given. So these things are very important. Cryptorchism we have to reveal, and lack of secondary sexual character we have to remove. Screening for STI I told already. Yes, I will finish. This one case report, a girl who was working in a 2 minutes, I will finish. This girl, she was working in a AIDS control program in a voluntary organization. She fixed to be, her marriage was fixed with a man who is working in Mumbai. It was long back. Mumbai was the city previously. HIV was transmission were very abundant. So she was working in a HIV program. So she knows. She wants her would-be has to be tested for HIV. And she told, I will also test, you will also test. That will be safe for us. But the individual says, okay. Then going back home, and everybody got stuck, and no, this girl we don't want. She is asking, demand for our son to have HIV, and marriage was broken. So then that girl got married, that is different. Married and she is happy. So counseling on the basis of examination and investigation, tailor-made sex education, fertility education, health education and genital hygiene, partner satisfaction, patting, care, love is very important. Foreplay, yes. So most often this is very lacking. People don't know about the foreplay. Without foreplay, the girl cannot attain orgasm, arousal, anything. So we have to tell them about the foreplay and afterplay. Afterplay also, most of them not known. So usually, I will tell, that is after ejaculation, the man got exhausted and feels sleepy and sleep on the side. That no girl will like it. She wants to beat him. After finishing, he is enjoying and sleeping. So after she is washing or piecing and she came and she has to hug her and pat her and he is putting her legs over her. So like that only, that's afterplay. Only with that she'll be very happy. So all these things are very important, we have to impart. Address venerophobia, HIV phobia. I am not telling unmarried HIV positive. So having children, so many things are there. So I am skipping HIV infection. What are the common questions asked? Sex is a natural drive. Physicians should not ignore the basic needs of their patients, and at the same time, STI physicians should be careful not to lead single new infection among the couple, to especially partner and any population. Appropriate diagnosis and management, partner management, condom promotion, pre-exposure prophylaxis, follow-ups, correct guidance to the patient are equally important. The guidance differs from patient to patient according to their situation. Thank you very much for having patient listening. Sorry, I exceed my time.
Thank you, sir.
Yes, audible.
This after play, that means as and when ejaculation occurs, male partner becomes tired and he cannot do any activity.
No,
sir.
always tired, but you have to
But it
give
is
some
it's
importance to
compulsory.
receive the partner and hug her.
It will be a
and put it.
punishment. It will be a punishment for men.
Punishment for your wife also. Thank you.